This is the first edition of Off the Cuff with myself. I am Dr. Minter, and I've got
Nurse Bryan.
And we are correctional medical personnel, nursing personnel, and we want to talk to you about jails and prisons because that's where we work. Mm-hmm. And we have had a lot of questions about what it's like working in jail. In fact, I was at a national conference, and it garnered a lot of questions. So we both work currently in jail. Where did you, Nurse Bryan, where did you work? You worked in jail or prison always?
So I worked in the emergency department first. Tried that out as a baby nurse. Didn't like it too much. I probably lasted 6 months there. And then I went online, and I believe it was Indeed. And I saw an ad for a correctional nurse at Davidson County Correctional Facility. It was all male prison, or jail, rather. And I thought, you know what? Let's give this a shot. This can't be too bad. And they had me go through the entire orientation before they had me go have a tour of the jail. Thought that was kind of interesting. And then when I decided to come back home to Florida, I knew I wanted to do corrections still. So I went online. I found that, another ad for another jail, and got a job there. And I feel like correctional nursing is like my niche. And I think it's like a hidden gem of nursing too. Don't you think?
I do. Why do you like it?
Oh, gosh. Well, I really do like taking care of patients that basically pretty much never had health care before. So it's like providing that care to like the underserved community. I really like that a lot.
So I kind of fell into correctional nursing a little bit different. I was working as an RN because my kids were younger, and then I graduated a long, long time ago as a nurse practitioner. I graduated in 2001, but I worked mostly as a hospital supervisor as an RN. So then I moved to North Carolina, and I recertified as a nurse practitioner because I hadn't been working. So after I recertified, my kids were older. I thought, okay, it's time to apply for a job. But I was in a fairly rural area, so the only job really around was a prison.
Nice choice.
So I applied, and they called me the same day. And they said, when can you come in? Well, at the time, I didn't know that the job had been open for over a year. And the warden had told me later, he said 367 days and 47 minutes.
Oh my gosh.
And I also didn't know that the contractor was being fined 3 times the nurse practitioner's salary for not filling it, which is a standard non-fill cost. So I went in and interviewed with HR and the HSA. So the HSA is a health service administrator. That's a generic term for the person in charge of a prison or a jail of the medical department. And it's usually a nurse. It's not always a nurse. In this case, it was a nurse. What I didn't know also was that the medical director had issues with throwing things.
Oh my gosh.
So he had gone through 4 or 5 other MDs, NPs, and PAs because he would get frustrated. He was an old thoracic surgeon. And then he would throw a chart across the room.
Oh, it's awful.
So people just wouldn't come back.
Yeah, I think not. Gosh.
So they said, let's go in and meet the medical director. And of course, I didn't know any of that then. I'm like, okay. I should have known. And they said, let's go in and meet the medical director. They said, he is crazy. That should have been my first red flag. Mm-hmm. So anyway, they made me an offer, unbeknownst to me, the whole backstory of this whole temper tantrum. And I started, and we got along great. We had a great relationship, and he stopped throwing things.
I was going to ask you next if he threw anything at you.
Once he got really mad, and he said, I just stood up to him, and I said, you are a big and he said, no, I'm not. I am the biggest.
Oh, he claimed it. He claimed
Then we cracked up. So anyway, I worked there for a couple of years, and that's another story for another time. But then I worked in the community for a couple of years and then came down to Florida and decided to try jail. And one of the questions probably people have asked is, what's the difference between prison and jail? You get that?
See, I've only worked in the jail, so it's hard for me to answer that probably.
You know what the difference is?
Well, long term, you're sentenced.
Sentenced.
Yeah.
Well, you know that.
Yeah.
But a lot of people don't, so they mix up prison and jail.
Mm-hmm.
But big difference.
Yeah.
So the difference between jail and prison, the way it was explained to me by a friend of mine who's a psychiatrist who's been in both before I was in jail. Anyway, prison is more like internal medicine. Everybody's tends to be more stable because they've already had health care. Why? Because they've been in jail.
Mm-hmm.
But whenever people come in jail, it's just a roulette. They could have no health care. Yeah, they don't. You can have anything. Mm-hmm. And they generally are not medically stable. So it's more of an emergency room.
It really is.
Right.
From the moment they walk in that door, we take care of them.
Right. That's the difference between jail and prison. It's more just managing all the chronic issues in prison. So a little bit, I think there's a little bit more entitlement sometimes in prison. But jail, because you see pretty much everything.
Sure do.
I've had attorneys ask me, I had an attorney ask me a couple weeks ago, they said to me, why do you work in corrections if you have a clean license?
Oh, that's a whole subject right there.
Yeah, because I think that the thought is that people that work in corrections are there because of a license thing, mm-hmm. which I mean, it can be true, but some people work there because they want to work there.
Right.
And I don't know if that's a difference from the hospital or not, or I don't know. I don't know what your experience is with that.
You know, if you work at the right place, they do a thorough background check, polygraph exams, the whole nine.
I think some nurses work in jails or prisons because there's not that stipulation that you have to have a bachelor's degree. Mm-hmm. And a lot of the hospitals have that because of magnet status.
Right.
So they want that magnet status, which means that everybody's got to have a bachelor's degree. I think if you're management, you might have to have a master's degree.
Right.
So if you only have an associate degree, then it kind of limits you as to where you're working.
Right.
So, and that's another reason. And there's nothing wrong with that. I was an associate degree nurse way back when, mm-hmm. and then worked my way up the ranks. But I think that's another reason why some nurses are in corrections.
I think they're scared too. You know, every time I talk to friends and they're like, how do you work at the jail? Like, how are you doing that? Are you scared? You know, I'm like, no. But they have this, thought in their mind that, they're going to get stabbed or they're going to, something bad's going to happen to them because they think they're all murderers and rapists. And that's not true. Mm-hmm. And we have people there for petty theft, just silly stuff, trespassing. Not everyone's a bad person. And to me, they're just people in orange, I try not to look at their charges if I can. If I can avoid it, I like to treat everyone the same, right. Just like you would at the hospital. You don't go and ask them, well, what's your background? What have you done? No.
Well, I think that you're probably safer in jail than you are in Walmart because the same people are walking around Walmart, except you don't have a correctional officer one-on-one
1,000%
with you.
Right.
So, I mean, we always have somebody within arm's length of us.
Right. And even when I worked in the emergency roast, they had like a security guard, but he was covering the entire hospital. So it's like here at the jail, it's like you always have someone within arm's reach, at least within voice's reach. So you can tell them, hey, help me. But, I haven't had that experience yet. I haven't had to. Everyone I've dealt with is, it's been good.
Yeah, it's because we're not in Walmart or
that's right.
the hospital. Another attorney asked me, because I do malpractice cases, mm-hmm. What seems obvious to us is not always obvious to other people. So I wanted to talk about some of the types of medical personnel that are in a jail mm-hmm. or a prison.
Right.
So what do we have?
Oh, boy. So
start with us.
Okay. So we've got nurse practitioners. We have PAs. We have psychiatrists. We have dentists. We have dialysis nurses that come in. We have physical therapists that come in, which is awesome because they don't have to go and they don't have to leave. There's no risk of a flight, for them to just leave and run.
But we've got, explain the nursing
Aspect of it.
Right. So what's the difference between an RN, an LPN, an MA? What's an MA?
So
if you see those signatures on a chart.
Right. So like the MA, they'll do like the basic stuff, vital signs, basically just taking notes, really honestly. And then we've got the LPNs, they're doing medication passes, diabetics.
What's an LPN?
Licensed practical nurse.
And how much education do they have?
I think it's about 2 years.
I think it's a year or two.
Is it a year? Is it a year?
It might be a year.
Yeah, because I went straight from my RN, so I didn't really start at the LPN.
It's a vocational kind of entry-level nursing.
Right, exactly.
They don't yet generally do IVs or a higher level of assessments.
Correct, especially if they have an RN around to do it.
Correct.
Yeah.
So then you have the RN.
Yep, you got the registered nurse.
But you also have, registered nurses some are associate degree, some have bachelor's,
right,
some have master's, but they all pretty much function under the registered nurse
right.
license. And what do you do?
So where I work at the jail, I am the upfront nurse. So basically, I pretty much triage everyone that comes through the door, whether they've got dog bites, which can be pretty nasty. We got gunshot wounds, people who got medically cleared at the hospital for whatever reason, whether it's alcohol intoxication or a motor vehicle accident. It's pretty gnarly up front.
Yeah.
You see a lot.
So an RN's usually up front?
Yes, they're doing the initial assessment. Yep.
Okay. Then I'll add that just like people, there's little jails and big jails and fat jails and large jails. So there's some jails around the country that are maybe only 100 inmates or less.
God, that'd be nice.
And then there's some jails, like I think Cook County in Chicago and Los Angeles, they're upwards of, I think, 20,000 inmates. Oof. And they may be chopped up, in different buildings or whatever. So jails have different levels of personnel. You can't have the same amount of personnel that in a little jail that you would in a large jail.
For sure, yeah.
They also have sometimes in the smaller jails, the correctional officers are cross-trained. Like they might be EMTs, so they may do the screening.
Right.
So it doesn't have to be an RN, but in a bigger jail it tends to be.
Yeah, that's true.
So, all right, so we got LPNs, we got RNs, we got the medical assistants my medical assistant in my other jail, she did all the blood work. Mm-hmm. She did a lot of scribing, just overall task-oriented stuff. And then we have PAs. You said PAs. What's PA?
Physician's assistant.
Yeah, so they function and can give medication and function as a provider.
Right.
They usually have to have a collaborative agreement with a physician.
Right. Don't they work underneath the physician?
Yeah, I don't know if it's technically underneath, but they have to have an agreement that they're working with that person. Nurse practitioners like myself, so it used to be that when it started in the 60s, nurse practitioners had bachelor's degrees and then a little bit extra experience at that point.
Extra training or something?
Correct.
Yeah.
And that was to fill the gap for primary care, kind of after World War II, that there wasn't enough primary care providers. And then it became having a master's degree, and now it's going to have a doctorate degree. So I have a doctorate degree, but I'm not a physician. I'm a nurse practitioner with a doctorate. But I basically function with my master's nurse practitioner. So we prescribe medications, see patients, and just manage care. I do not work under a collaborative agreement, as it's called, with a physician, because in this state, you can have what's called an autonomous license, meaning that you work independently, and I have that. You have to have a certain amount of postgraduate education. So what else? We've got mental health people.
Yes, super important in a jail, in prison.
Yeah. And I texted a friend of mine who's a psychiatrist. I said, what kind of different licensing do you have in jail? And it was like this huge list LMHCs, you got licensed mental health counselors, you got psychologists, which may be the same, you've got social workers, and then you've got nurse practitioners that are psych specifically. Then you got psychiatrists. So, and then people say, can you get medications in jail? Yeah. Yeah,
Of course you can.
Yeah, I mean, so we have what's called a formulary, which is no different than Blue Cross Blue Shield per se. Like if you go to the drugstore, you have to have something that's on formulary. Otherwise, you have to get authorization. Blah blah blah. Same thing in jail. Common drugs, common list of drugs, and then we just order them, and then they get them. And then how does it? You know, I know what we need to talk about is. How does somebody get seen if they have a medical problem? Say you have a sprained ankle.
All right, so you're talking about when they're already there?
Mm-hmm.
Okay, so if they have a sprained ankle, they're going to have to put a nurse sick call in.
Okay, what's a nurse sick call?
So basically, like if they have any kind of medical complaint, whether it's a stomach ache, headache, anything that's not emergent or urgent, they can put a nurse sick call in, and usually they're seen within 12 to 24 hours.
So what's a nurse sick call?
So sometimes they'll put it in on paper form, and they'll put it in a box, and then the nurses go through the papers, and they'll, kind of like triage them. They'll go through and see what's important and what's not, and what can wait, basically. Some people would put in sick calls, and they'd be like, chest pain. We're like, who puts in a sick call for chest pain? Just tell the detention and get one of the nurses now. Some places, they'll do it on a kiosk, like a computer, like almost like a little touch screen, and they'll put their docket in there, and they'll request to see a nurse that way, and it gets filtered. And then every day, the nurses will draw that list, and they'll, if it's a big jail, they'll split it up, and certain nurses will see this building, certain nurses will see this building or this pod or area, and basically just treat them that way and address their problems.
What do you do?
So if it's a sprained ankle, if it's swollen, I can see that it's swollen, it's painful to the touch, basically I just do a full assessment of that. I look at what can be offered to the patient based off of their medical complaint, like a sprained ankle. So if they have ibuprofen, it's swollen. Usually they'll have like a list on there, so they'll say, or I'll ask them rather, how did this happen? You know, when did this happen? What's the pain, 0 to 10? 10 being ran over by a car. Basically things like that. And if it's to the point where they can't even walk on it, I might call the provider and say, hey, do you want to get an x-ray on this to make sure there's no fracture? That kind of thing.
So most jails have somebody on call if they're not there.
Correct. Yeah.
And then they get evaluated by the provider and then determine from there what happens.
It can be. So if it's like something like as simple as like, I'm trying to think, like a headache, we can go ahead and give them whatever the protocol may be. So if it's like 3 days of Tylenol, or you can choose between Tylenol and ibuprofen based off of maybe their allergies, we can do that. And then I always tell them, hey, if this isn't working for you and you still have a headache after a few days, go ahead and put another nurse sick call in, and let's, go from there and see if you need to see the provider and maybe investigate this further.
What if it's urgent? What if it's chest pain or something? How does that work?
So
not necessarily in one place, but overall in your experience.
So you mean like if they're in the pod complaining of chest pain?
Well, I mean, if you've worked in different correctional facilities, so like overall, like how do you treat something that's urgent? Like how does it get to you?
So like I said, depending on where you work, but if it's a paper form or the kiosk and, we see that it's chest pain, we address it immediately, like you said. We'll go ahead and, get an EKG started, get a set of vitals, see where they're at, and then, of course, we ask them the same questions. What's the pain feel like? Is it burning? Is it sharp? Is it intermittent? Does it come and go, basically? Is it constant? And kind of go through there, from there and go look at the EKG, see what's going on. Are they having a heart attack, or is it just normal EKG? Of course, if it's abnormal, we're going to call the provider and just say, hey, this is what's going on, and what do you want to do from here?
So what if an inmate's got to go out to the hospital? Can they do that?
Oh yeah, absolutely. Yeah, of course. We never ever deny care of having them transported to a hospital to further evaluate whatever it may be. If it's a chest pain, or maybe they fell and they had a head injury and they've got a head bleed. You can see from the outside, but we don't know what's going on internally. We can't tell, so we'll send them out to the hospital.
Right.
Yeah.
I think there's, I've had questions in terms of, how do people even go out to the hospital? It's coordination, but we still provide the care.
Right, exactly. Because we have to We have to talk to detention. We get the sergeants involved. We let them know, hey, this guy's going out either emergent based off of, the patient's needs, or non-emergent, something that can kind of wait but needs to still be seen at the hospital. So the, detention staff will have to find a deputy to be the transport, and they'll have to leave and go stay with the patient until their shift's over, and then they'll have to have another deputy cover after that if they're still at the hospital, that is.
Right. And then in terms of like people with medical conditions when they come in, how do you figure out whether they really have that condition? Because I've had it where people really don't have a condition, and I think there's some thought, oh, well, yeah, sure you have that or whatever else. But how do you verify it? If they come in and they said, I had 5 heart attacks last year.
Oh, so we'll either call
10.
Oh, good Lord. So we'll either call the hospital or wherever they, were provided care and verify that way, or we'll have them sign a release of information to obtain their records, and we'll fax it, and we'll have it faxed back to us so we can get all those records to see if they're full of shit or not, basically.
And then how do we get drugs? Like, how do we get medications? Not drugs, but meds.
Drugs.
How do we get medications for inmates?
So we have medication carts. Of course, they're locked. They're locked, and then the door leading into the medication cart is going to be locked. And then all the, the controlled medications are locked in a box inside the cart. So we get medications there, but we have a pharmacy on site. We have pharmacy techs that work during the day, and they make sure that we always have what we need. If we're ever coming up short on anything, whether it's supplies, wound care supplies, whatever, they'll order it. So they always make sure we have everything we need. Now, the non-forms, I'm not really sure how that works with the non-forms.
Yeah, and that varies jail to jail, too.
Right.
But, I think most jails, either if they don't have an on-site pharmacy, they at least have a contract pharmacy that brings them in. And then how do we verify? If you're seeing some guy up front in booking or intake, that's the other thing, is that booking and intake is pretty much the same thing wherever you're at.
Right.
The words are the same. So booking is kind of a ubiquitous word for when you come to jail.
Correct.
Right. So when you come to jail in booking, then you say, okay, I'm on 5 different medications. So now some jails, you can pull a program in, like a program will bring in the pharmacy list.
Which is awesome, by the way, because I'll look, sometimes you look it up by their zip code. So you'll type in their zip code, and they'll tell me, oh, I'm on this and this, but they'll say, I forgot what 3rd medication I'm on. And then I'll pull it up, and they're like, how did you know that? How did you know my medications? I'm like, magic.
Because it's a separate program.
Right, exactly.
Yeah, but say you're in the middle of nowhere, like you're in Alaska. You don't have that program.
Right.
So then what do you do to get the medication? To get the list?
The list. So basically, that release of information, again, that's all we can really do to obtain records and get them sent back to us. And usually places are pretty quick about, getting records back so we can verify their medications. Sometimes people come in with the medications from the front in booking. They'll have a whole bag, whole pharmacy. Sometimes people come in with like 15 bottles. I have to go up front and I have to, verify, open the bottle, because sometimes they're dark. So you're like, open it up and you're like, well, I wonder what's in here. Is it weed? Like, you don't know. People bring stuff in all the time. They keep, they mix bottles and stuff. But that's another form of verification, is just, them coming in and bringing their own meds, and you look at the date, make sure it's current. It's this is for 30 days starting, 2 days ago. Okay, you're good. Go ahead and get them started on it.
I got to admit that if I was getting arrested, I don't know if grabbing my bottle of, blood pressure medication is probably the first thing that.
I know.
Maybe, I don't know, well, depending on what
so usually, like, the people that come in with their medication, they had it in their purse, the females, or it might be part of the homeless population. They'll have it in their backpack, and they'll have a lot of medications to go through. Some are super old, too. They don't take them like they're supposed to. They don't take them like prescribed. So it could be a 2-year-old medication that they still have pills left over,
Right.
So.
Yeah, because they say, oh, well, I'm like, well, this was filled 4 months ago. And they're like, well, I borrowed some, or I took my friend's.
Right, exactly.
Whatever. I'm
yeah.
Like, do you know what the dose was? Well, no.
It's funny, too, because sometimes they'll say, I'm on this blood pressure medication, like it's like a Minapil. I'm like, lisinopril. Yeah, that's the one. Yeah, so like it's funny because I feel like I've learned this language of medication through time of just working at the jail, and I try to help them. And of course, I'll call the provider, and if they tell me, hey, I take lisinopril 5 daily or whatever it may be, you'll call the provider and
what's
just
the
tell
chance of that? Versus the Minapil.
I know.
Guessing.
Yeah.
Yeah, you feel like you're trying to like. It sounds like
right.
What? Mm-hmm. What's it look like?
Exactly. Yeah. And sometimes it's sad because they'll say, well, my wife deals with all that, or my husband. I'm like, oh my gosh, come on, guys. You don't even know the names of your medication. Come on.
Yeah.
So, but yeah.
Or how many you take, or
anything. They don't even know the milligrams, the dose, whatever. They don't know nothing.
Yeah.
Yeah.
Yeah. It's its own world.
It sure is. It really, really is.
But anyway, well, let's hold the podcast for our first off-the-cuff podcast as to what introduction is for jail and prison.
Right.
Pretty much the same. And I'm Dr. Minter.
And I'm Nurse Bryan.
And we'll see you next time.